Hello, this is Janet Michael. In addition to hosting The Valley Today each weekday at noon on the River 95.3, I also produce podcasts, and I'm excited to introduce you to a new podcast series in partnership with Lord Fairfax Community College. Having provided higher education and career training for the past half-century, LFCC is tightly interwoven into the fabric of the Northern Shenandoah Valley and Piedmont regions. Join me every week for conversations with current and former students to hear their funny and inspiring stories as we learn about their journey to higher education, the role that LFCC has played, where they are now, and where they plan to go. We'll also talk to current and former professors about their experiences and best memories of LFCC over the past 50 years. Get every single episode as they're released on our website at theriver953.com under the podcast tab, or you can subscribe for free in Apple Podcast, Google Podcast, on Spotify, Amazon Music, wherever you listen to podcasts. Just search for LFCC Stories. Hello and welcome to The Valley Today. I am your host, Janet Michael. Happy Monday as you are listening to the show today. We, of course, have pre-recorded our conversation on the Zoom screen. I am very happy to welcome back to the show Dr. Brendan Flynn. He is the Chief Medical Officer at Blue Ridge Hospice. And Dr. Flynn, we were talking before we started recording that it's been nearly a year and a half, and since you were on the show in October of 2019, and none of us had any idea what we were in for when we were having this great conversation about a fundraiser concert you guys were doing.
Yeah, those were the days. I tell you, I look back on how simple those days were. But time has flown.
We are all forever changed, I think.
We are indeed.
So tell me how COVID has impacted hospice, because you guys had to kind of change up a lot of what you were doing. You didn't get to just close your doors and say, okay, we're going to wait this thing out. You had patients that still needed care regardless of outside circumstances.
We did. And again, Janet, thank you for having me. It's a pleasure to be here again. But you're exactly right. You know, what makes hospice care unique in a lot of ways as far as healthcare delivery is that we come to you where you are in your home or your residence, wherever that may be. And we are caring for patients who are facing life-limiting illnesses or maybe at end of life, and that can't just stop because we're on lockdown. And so there were definite inherent challenges that we saw right away coming that we had to adjust to very quickly. And so, a lot of questions came to the forefront of how do we not only keep our staff safe in this new world of a pandemic, securing PPE and getting that done quickly, but also being nimble enough to make sure that we can deliver our quality care to our patients where they are, but still adjusting to what we had to adjust to, and that was a pandemic and the real threat of this virus. So it was definitely a challenge.
Well, I would guess too that almost all of your patients were in as high risk of a category as any of us would ever think they would be because of why they were in hospice care to begin with.
Exactly right. These are patients who already have multiple comorbidities, who already are terminally ill. And so they are the highest risk of all, when it comes to contracting this virus. And that was always our biggest fear, was how do we keep our patients in a bubble, keeping them safe? And indeed, their families at home were very hesitant about allowing others into the house, understandably so. So it was a matter of educating and reassuring families that we are not bringing this virus into their house. We have many measures in place for safety protocol that allow our staff to remain as safe and virus-free as possible, to reassure patients and families that not only are we going to continue to deliver the quality care to you, but we're also not going to put you at an increased risk. But how do we keep our patients safe at home? And so you're exactly right. These are the highest risk patients, and our goal is to keep these patients out of the hospital and keep them safe at home where they want to be. And so, yeah, it was the biggest challenge of my professional career, that's for sure.
I had a conversation a few weeks ago with Sheriff Flynn Milholland from the Frederick County Sheriff's Office, and we were talking a little bit about COVID's impact on his office over the year. They were similar to you in that they already had PPE, they had things that they had because of the course of what they do during the day. What kind of a struggle was it for you guys to suddenly, you have all this stuff, but now you're going to need so much more of it
Right.
to keep everybody safe?
We thought we had it. And then, early March came along and we realized, gosh, we don't really. I mean, in the hospice setting, we certainly will have gowns and we have, typical PPE, such as gloves and things like that. But when it comes to face shields and eye protection and KN95 masks, those were things that we did not have. And so our staff has been amazing in pulling together different resources and very quickly getting a good stockpile of appropriate PPE that we needed in the moment. But I'll tell you, Janet, what really helped us in the early days was our amazing, almost army of volunteers that we have at the Blue Ridge Hospice. We put out a call I want to say probably the middle part of March, that first week of when things were really changing, when we realized that my nurses and our CNAs and our providers were not going to have enough masks. And we put out a call to the volunteers to please sew as many fabric masks as you could. And we sent out a template for that mask. And within a week, we had 500 masks. And it was, I still, it was amazing. It was so amazing. I remember putting this big pile of fabric masks on our boardroom table and having the nurses come in to take 5 each. And that really helped us bridge the gap between when there was such a shortage to when that shortage really opened up, and it allowed our staff to stay safe. And it really, it was amazing to see. So that was just one story that I'll never forget, when our community stepped up to help Blue Ridge Hospice, and it allowed us to continue to provide the care that we were able to do in the moment.
Hospice care, I've learned, is very hands-on. It's very personal. You get to know the families, not just the patients that you're dealing with, but their families as well. I know that from talking with a lot of Valley Health professionals, they transition to telehealth. You could talk to a doctor on your phone. You could do it with a video chat, that sort of thing. Were you able to implement any of those kinds of things in hospice, or is that just not was that not feasible?
We were, and I think it depends on the role that the hospice team member fills. So certainly, when we have our home health aide coming in to provide a bath, that's not something we can replicate over telehealth. So we still have our nurses and our health aides coming in to provide that necessary hands-on care to the patient at the bedside. However, we were able to adjust, especially in the dark days of the pandemic, where we weren't sure really where we were, to allow our providers, such as myself and our nurse practitioners, but also our supplemental therapies like music therapy and chaplain services and our social work services, and even volunteers, having those folks provide a presence in the home over telehealth. And that's something that we quickly adjusted to. We were able to acquire a large amount of tablets, to the point where we could, if needed to, we could put a tablet just in about every patient's home, and as well as our facilities. That allowed us to, with just the push of a button on the family's end, to see our face right then and there. And it's allowed us to be a lot more efficient at the same time. I think it's something that's not going to go away. And I think medical professionals across the world have realized that although they may not have had any comfort with telehealth before, we've all been forced to have comfort care, patients alike. And I think it's allowed us to be a lot more efficient where, perhaps a nurse is out with a patient who may be having some type of acute symptom, and that would have been a phone call to me. And now it can be, they open up their laptop and I can actually physically see them, and visualize what's going on in the moment. So it's like I'm there. And that's something that's a silver lining with this pandemic that really probably wouldn't have happened, had our hand not been forced to learn how to do that. And then I'll also say that as far as the telehealth, it's also been a viable and really crucial aspect of providing our presence in facilities, nursing homes, assisted living facilities, really had to necessarily really lock down their doors because, again, those were the residents who were at such high risk. And how did we allow our staff to still have a presence in there? And a lot of facilities allowed us to kind of embed a tablet there so that we could visualize our patients. And it also allowed some family members who were not able to come visit their loved ones to have a portal to come and see their loved ones through our tablets as well. So it's been a really successful part of our response to this pandemic that I don't think is going to go away. So it's been really a success story.
It's interesting. I remember my early understandings of hospice. I always thought of hospice as, and you've mentioned this several times, when they come to your home. So, grandma, granddad, father, daughter, son, they don't have to leave their house. I had never really thought about the facilities until I had several conversations with different people from hospice that you also provide care to people who are in nursing homes, assisted living facilities, things like that. So, I can imagine how frustrating and scary that had to be for you guys in the middle of COVID.
No doubt. Yeah. And Janet, I would say about 50% of, maybe 40 to 50% of our patients with Blue Ridge Hospice are in facilities. And yeah, scary for us, but even scarier for the facility staff who were really just having to be those heroes especially in facilities that had outbreaks, very, very difficult situations. And my heart would break for our patients in those buildings, in those residents who, had to be confined to their room. They couldn't be in common areas. They couldn't socialize. And it's been so hard on so many levels. It's now starting to ease up thanks to the vaccine, and we're now able to really get back into these buildings, and we're starting to see some of those things open up, and that's been so great to see. But it was tough.
Well, let's take a quick break. When we come back, can we talk a little bit about the vaccine rollout? How has that been going with your staff and your patients? Can we get into the weeds on that a little bit in the next segment?
I think so. That'd be great.
Okay, we're going to take a quick break. When we come back, we're going to continue our conversation on the Zoom screen. We are pre-recording with Dr. Brendan Flynn. He is the Chief Medical Officer at Blue Ridge Hospice, and we will be back in just a couple of minutes.
Got a financial decision to make or a goal to reach, but you don't know where to start? You've come to the right place. Introducing Quick Money Chats with the Northern Shenandoah Valley Financial Education Program. Visit tinyurl.com/quickmoneychat to schedule a virtual chat with a staff member or trained volunteer. We won't tell you what to do, but we will give you the tools you need to choose wisely. And because Virginia Cooperative Extension is part of Virginia Tech and Virginia State, your land-grant universities, you can be sure that our information is credible and trustworthy. And you'll know that we aren't trying to sell you something. Maybe you want to improve your credit score, or reduce your banking overdraft fees, or even figure out if you can afford to buy that car. Sorting through tons of information on the internet can be overwhelming, and sometimes it can be hard to know who to trust. Schedule a Quick Money Chat and get the information you need to take action. Go to tinyurl.com/quickmoneychat and get financial education personalized for you.
Welcome back to the Valley today. I am your host, Janet Michael. Happy Monday. As you are listening to the show today, we have pre-recorded our conversation on the Zoom screen. We are chatting today with Dr. Brendan Flynn. He is the Chief Medical Officer for Blue Ridge Hospice. And Dr. Flynn, we were talking when we went to break about COVID and the pivot and all of the hurdles that hospice had to overcome to continue giving the high quality care that you do to all your patients. And then suddenly we have a vaccine. January gets here and we realize, wait, there might be a little bit of a light at the end of the tunnel. How did the vaccine impact what you guys were able to do moving forward?
Well, it changed everything. The vaccine, I was fortunate enough to get it early on as a healthcare provider, started to get it just around Christmas time. And our clinical staff have been able to get it, again, earlier on. And what that allowed our clinical staff to do, not just our nurses and our home health aides, but the folks that would typically be in the field providing care and therapy, like our music therapists therapists, like, our chaplains, like our social workers, and even our volunteers. Those are folks that we've had to kind of keep at bay through telehealth because, we were concerned about their safety as well. And allowing them to get this vaccine has given us, pretty much freedom to allow those folks to come back out into the field safely, and come back into the home, come back into the facility. So to answer your question, it's allowed Blue Ridge Hospice to have our complete team once again out into the field, so that we can support patients and families in person as we had been pre-pandemic, which has been such a boost to morale for us. It's been such a spirit lifter for our patients and families who have missed those folks. And it's really allowing us to provide the total picture of what hospice care is in person. So it's been a game changer.
And as a medical service provider, I mean, you're not like Valley Health. You didn't get shipments to hospice of the vaccines that you could then dole out as necessary. You were still dependent on those partnerships with, I would assume, Shenandoah University, Valley Health, all of the health department, all of those places as well.
Exactly. Yeah. And I can't say enough about Valley Health. They have done an amazing job. They have been just an example setter for the rest of the state and the country as far as how you do this, and you vaccinate a population of people. And the way that they have partnered with, like you say, Shenandoah University, where I was happy enough to volunteer to be a vaccinator not too long ago. That was a great experience, to just really being able to roll this vaccine out in a very methodical and appropriate way, has been fantastic. It's been a great experience. They have done an amazing job. I can't say enough about it. But you're right. We were really kind of reliant on them to let us know when our staff was appropriate to be vaccinated, and then getting them processed through their vaccination project and effort. But it's gone amazingly well. But yeah, you're right. Blue Ridge Hospice doesn't have a supply of vaccine that we can distribute. We're kind of cooperating and coordinating with Valley Health as the main vaccinator in our area.
Do you foresee that changing as more vaccines become available, and especially now with the J&J shot that is a one and done? Do you think that may change in the coming weeks or months?
I do, and I think that that's the plan. I think what they're hoping to do is to kind of distribute the vaccine. Now it's going to become much more available into individual physicians' offices and much more smaller mobile satellite vaccination sites. And Blue Ridge Hospice, we're going to also plan to partner with Valley Health now that these newer vaccines are going to be much more amenable to being given in the field. We have, certainly we have homebound elderly patients and homebound patients who are at high risk who would like to have this vaccine and have not had the opportunity to do so. And so we're going to look at partnering with Valley Health and how can we get this vaccine to our homebound patients now that it's becoming much more feasible to do so. And that's going to be coming in the coming weeks.
I talked to Dr. Fight a few weeks ago about just the vaccine in general, and I know he mentioned that that was one of their next big goals is getting it into doctors' offices and then getting it into a mobile version that can go to the homes of people who can't leave to get it for themselves.
Yep, that's exactly right. That's the next phase. I think we're going to be moving into, the state of Virginia is going to be moving into phase 2 pretty quickly, next couple of weeks or so, and that's going to basically allow all adults over the age of 16 to be benefit from this vaccine and to receive it. And again, it's going to be kind of eyeing up those folks who have not been able to get out of their homes. How do we get the vaccine to them?
And it's interesting too. I mean, you're the chief medical, officer for Blue Ridge Hospice. You're seeing patients, you're overseeing the treatment of patients, but then you've also got on the other side of this, all of this admin stuff. You've got to coordinate and make sure that this works. You've got to put together the plan. Did you sleep at all in the last year?
Well, amazingly I did. It's been a year. I think back a year from now, and boy, what was coming our way as a society. But certainly Blue Ridge Hospice, we were right there as far as weathering the storm. And I can't say enough about our team. I mean, I was one piece of that puzzle, and I was happy to play that role, and I hope I did it well. But I had a team around me of people that were amazing and stepped up in every way, from our IT department to, the fact that we were still able to keep our thrift stores open, and those folks who kept those stores humming, to every nurse and every CNA, and I can't say enough about the entire team around myself at Blue Ridge Hospice. So I certainly give all credit to them. But yeah, it's been an experience, and I think I've gotten a few hours of sleep, just to answer your question. Yeah.
I see Patty Fadley every Friday morning on a coffee break conversation that we have with the Front Royal Chamber. And the thing that always strikes me when she's talking about hospice is that it's a calling. And I think that's probably what has made you guys be able to get through this as well as you have, because as you mentioned, your entire team, your volunteers, everyone in the organization feels like it's a calling, and that just takes you to another level.
It really does. It really does. And it's been a calling for me too. I use this word a lot, but it's the best word I can find, and it's just a privilege. It's a privilege to do this job, and I'm lucky that I have a job that I get to say that about. And when you are dealing with serious illness and people in crisis, you get the job done and you do what we need to do, as so many healthcare professionals have done throughout this. But doing it in the home brings with it a whole set of challenges, but also a whole set of rewards. And so, yeah, I've witnessed that calling manifest itself throughout this past year with all of my coworkers. It's been amazing to see.
When you mention serious illness, what's the most common diagnosis that most patients come to hospice because they have? Is it cancer?
It used to be back, in the early days of hospice care, in the 80s, it was the vast majority of folks coming on hospice care had the diagnosis of advanced cancer. And that's really shifted over time, to where these days, really, I would say probably maybe half of our patients have cancer, and the other half would have what we would call just a chronic illness that has gotten to the point where curative treatment really is no longer a viable option, or the patient just really no longer wants to be back and forth to the hospital. They really want to be at home and focus on quality of life and comfort care. And so that could be any type of diagnosis, anywhere from dementia with Alzheimer's as a certainly very common type of dementia, to heart and lung disease. So we're thinking about COPD and emphysema, heart failure, and other diagnoses like neurologic diseases such as Parkinson's, folks who have suffered a stroke, advanced liver disease, advanced kidney disease, really those diagnoses that unfortunately do get worse with time. And at some point, folks reach that point where they have made the decision to no longer pursue that aggressive therapy and really just have quality of life be the number one emphasis for them, and have the care come to them where they live. And that's what we do.
Is that typically something that has to come from a doctor, a referral from a doctor? Can a family member just call up someone at hospice and say, hey, this is our situation. We'd really like to talk to you about giving some care to their loved one? How does that referral process work?
Yeah, that's a great question, Janet. And I would say that we see it across the spectrum, where oftentimes patients will be referred to us by their physician. And I'll just take a pause here, and I encourage, any loved one or caregiver or patient, when they're talking to their physician and they have questions about hospice care, to please bring it up. I think that your doctor might be hesitant to bring it up because they don't want to bring it up, a topic that sometimes can be difficult to talk about. But sometimes, as a former family practice physician, if a patient brings up the idea of hospice care, it really can open the door to a really good discussion. So oftentimes referrals come to us from physicians, but there are certainly cases where either a patient does not have a physician, or for whatever reason, the family or caregiver decides to call hospice because they're just curious about, is my loved one a good candidate for hospice care? And that's always welcome. And we can always send out a nurse to provide what we call an informational session, where we can just sit and talk about what hospice is. Would your loved one be appropriate for our care or not? And talking about the various avenues that are available to you, including what we do. And if that turns out to be an appropriate situation, we can certainly admit someone to hospice care without a physician's referral. If they have a physician, what we do is we always coordinate and communicate with that physician, though, so that everyone's on the same page.
I know that many of the services offered by Blue Ridge Hospice come at no charge to the patient and the patient's family, but that doesn't mean there is no cost associated with them. As a not-for-profit hospice, how can people support you? Checks with commas, or what I usually tell people, are always the best thing. We joked at the very top of the show about the last time you were on and you were doing your One More Song. We were having a conversation about that. You're going to try and do that again in July. How can people support you through that, through the website, donations? What do you need?
Well, I think that the best way and the easiest way would be just to go to our website, which is blueridgehospice.org. And that navigates you to a very easy way to donate. As you said, Janet, we are a nonprofit hospice. So we give back to our community as opposed to shareholders. And so, we really do rely on community support. And so our website is probably the easiest way to find your way to provide donations to Blue Ridge Hospice. But our phone number also is an easy way to get linked into someone that can help you with that. And that's area code 540-313-9200. And that is our main Blue Ridge Hospice phone number, and someone can assist you with that as well. So yeah, any types of support, be it financial or even volunteer. I think there's nothing more valuable than having a volunteer help us with administrative work or sitting at the bedside of one of our patients who may not have a family member, to all things in between. We welcome and appreciate immensely.
I will officially make the invite in early July to have you come back to talk
Awesome.
about the One More Song concert, only because on the Zoom screen right now, I see behind you a guitar, which I have to assume means you play. So the caveat is I'll let you come back in early July, but you might have to play a few strings of the guitar for me when you do.
Well, you want to keep your listenership, Janet, so I don't know if that's a good idea.
Dr. Flynn, thank you for taking some time out of your day to have a conversation with me. I really do appreciate it. It's been great.
It's been my pleasure, Janet. I look forward to talking to you again in July. That'd be great.
I will be back tomorrow. I will have a brand new episode of The Valley Today ready to go for you. It is Tourism Tuesday, so meet me back here for that just a few minutes after noon.